The Gauteng Health Department has opened a criminal case against a social media influencer claiming to be a medical doctor. Officials say the 27-year-old, popularly known as Matthew Lani, has been falsely presenting himself as an employee at Helen Joseph Hospital in Johannesburg, but he's now been exposed as fake and who apparently stole the identity of a medical intern at another institution. The Health Professions Council of South Africa and Wits University have all distanced themselves from this bogus doctor. And let's get you more on this. We'll speak to the Health Department in just a moment. But for now, let's welcome Dr. Magome Masike, who's with the Health Professions Council of South Africa, joining us now via our video link. And Doc, it's great to have you on the program. Thanks very much indeed for making time. You know, it was in June this year when the HPCSA actually came out to say about 120 bogus doctors have been found through your own campaign, your own work to try and root out these people from your profession. But I wonder how this particular story came to your attention. I mean, have you seen anything like this before?
No, not yet, but it's part of a process. Getting rid of bogus doctors in our country is a process and definitely not an event. We get quite a number of them, and my investigators are busy trying to get through to this particular person. We are now in consultation with the Department of Health in Gauteng, and the SAP has to be able to liaise. My investigators are busy so that once ultimately the arrest is made, we'll be able to give you information on it. You must remember, we are in the business of guiding the profession and protecting communities. We cannot let people out there treat unsuspecting communities without the relevant qualifications.
Absolutely. I mean, at risk here is not just people's lives, but also the credibility of the profession. Trust is such an important thing in what doctors do. But besides perhaps just, the Twitter trends and things like that, I'm hoping we'll be able to speak about what the law actually says and ways in which this person breached the law. What are the expectations from the HPCSA when someone wants to practice as a medical doctor in South Africa?
In terms of our act, no single doctor should practice in this country without having registered with us. So if somebody is practicing without any registration, that's an offense. It's a criminal offense, and they get arrested and prosecuted and sentenced.
And so you are able to tell us this morning, without any kind of fear of contradiction, that this person who goes by the name Dr. Matthew Lani is not registered with you guys?
We have checked our register. There is no such person, and therefore we are investigating, and we should be able to report as soon as we've got all our facts right.
As I mentioned earlier, Dr. Modiba is with the Gauteng Health Department, and he's also joining us for their perspective. Motaletale, thanks very much indeed for your time. You know, in many instances, we hear that bogus doctors hide in the private sector. This is certainly not one of those cases because this person was operating at Helen Joseph Hospital. How did he pull that off?
Let me first correct you there. It's not doctor, it's Mr. That's my colleague there from HPCSA, Immediate Technical Task. Look, I think it's one of the things that we're obviously looking into. And we must admit up front that I think this incident has obviously exposed obviously shortfalls and gaps within our system insofar as issues of access control, and then also insofar as issues of how we improve employee identification within the system. So it's not a 100% foolproof system. It can be exploited, and I think this incident proves that. And it's incumbent on us now to actually work on ensuring that we tighten those access systems that we currently have, and working closely with organizations like HPCSA, I think we can be able to ensure that we stem out this kind of practice that is unethical and that can have dire consequences for the millions of people that depend on public health care.
Absolutely. Do you know how long this person has been able to practice at Helen Joseph?
They were not practicing at Helen Joseph. I think we must just correct that as well. They were from time to time seen at the corridors of the facility, but they were not practicing at Helen Joseph. I think here we have someone who was utilizing an environment of a hospital to actually produce content that then would give them credence and in other platforms. If you look at what they were doing, their modus operandi, they would come into the facility and be in some corridors and some spaces, shoot content that seemed to be like it's medical content, and obviously on the other side, be able to leverage on that to get other opportunities. What we can tell from what we know is that probably our interaction with this person would have been in 2022 when we were running a particular campaign as a department, and we used them once during that particular time. But they were not definitely practicing because as a medical intern, in terms of our systems within the department, a medical intern would not be able to interact with patients on their own without supervision and without following particular strict protocols that are existing within the particular space. But in terms of movement within the facility, I think that's a gray area, and that's something that we're going to be looking into, because remember that public hospitals are public institutions that have got free movement. So what that means is that obviously you and I, when I come in to go and see someone that is in a hospital, it's taken that I'm going to that particular person and so forth. But as to what I do when I'm in the corridors becomes something else. And I think this incident has exposed us in that particular area to say we need to then tighten up those particular controls, because clearly not everyone who's coming into a healthcare facility is coming there with clean intentions.
Absolutely. I mean, but how do you know that he wasn't able to practice in that particular facility, Motaletale? Because being able to be there and being identifiable as a medical doctor may very well elicit the attention of unsuspecting patients who even approach you for medical advice, among other forms of assistance.
Well, I suppose where you are right is that part of the investigation now is to assist us to conclusively confirm that. But yesterday, the report that we were getting from the facility, from their records, their registrars, and so forth, it didn't seem like, obviously, he would have seen any patients, but we're not ruling anything out. That's why we've said they must go through all the records and be able to check. And I think even now, through these platforms, the public, members of the public who might have been seen by this person at that particular facility purporting to be a doctor, we're urging them to also come forward, because then that will then also assist us and assist the police in their investigations.
Dr. Masike, I mean, of course, what this also does, and I don't mean to kind of, breed into fear-mongering, is that it raises questions, at least from the public, about how many other, let's say, bogus doctors are able to gain free access into these public health facilities and present as doctors. I mean, one wonders the kind of power that they're able to wield in that context.
Yes, we shall work with Motaletale Modiba to make sure that there are systems in place to detect them, because it is a criminal offense to do so and fool our unsuspecting public. We cannot allow it. The law does not allow it. We are busy investigating now. As soon as we make an arrest, we should be able to tell the public.
Yeah. And what kind of, I don't know, in what ways does the law prevent something like this from happening again? Let's say this person is arrested, they have criminal charges. Is there anything within the Health Professions Act that will make it easy to identify this person if he were to attempt this again, Dr. Masike?
We get them, they get arrested, they get sentenced, and some of them, after being released or paying a fine, they go and open somewhere else.
Right.
So it's a problem that we are looking at, that we should have a register where these people are put out there for the public to know that these are not registered doctors.
Are you saying that register doesn't exist currently?
We have a register of qualified people. We do not have a register of unqualified people. But what we need to be doing is that we need them to be saying these are the ones we've arrested so far, so that the public is aware. Because it becomes an ongoing process. We arrest them today, they get arrested today. The following week, if they pay a fine, they open somewhere else. And they continue as if nothing has happened.
Sure, yeah. And I wonder, as you say that, how much headway we actually are making if people are able, if you like, to create that loop once again. But Motaletale, do we know where this person is as we currently speak? I mean, it's been quite some time now since, Wits University has come out. I think it was Cambridge College also that distanced themselves. It's been a couple of hours since the Health Department released a statement distancing themselves from this person. Between that time, have we been able to locate him? Because since then, he's released his own content, let's call it, completely dismissing all of this as nothing but hogwash, suggesting that haters are out to get him once again.
Look, the police are currently investigating, and if this is hogwash, we are urgently asking him to present himself, provide his ID number, his personal number, so that it can be checked on the system. I mean, all of us, including myself as a public servant, I've got a personal number. If I give you my personal number, it can be run on the government system. You can tell whether I'm employed by government and when was I employed by government, when did I leave, when did I come back to the system. So if all of this is hogwash, it's very simple. It's for him to present himself at the nearest police station and say, I'm innocent and I'll prove my case. Here is why go into hiding if all of this is hogwash. So the police are obviously currently investigating, looking for him. But if indeed it's a hogwash, let him come forth, present himself. He has nothing to hide. He has nothing to fear.
Let's try and empower the public as well. I can think of, scenarios where people are now are going to be a bit more cautious, let's call it, where whenever they try to receive any kind of service from doctors in the private or public sector. Dr. Masike, what can we do to verify whether somebody is qualified for what they do without upsetting the dynamic, if you know what I mean?
You can take the names and the qualifications and phone the call center of the Health Professions Council of South Africa. We can verify whether that's a doctor or not.
Are you able to share that number with us right now?
Well, I will not have it. I will not have it with me now, but I can do that offline.
Okay, well, we'll try to get that to our viewers. And how quick is that process, by the way? If I'm, getting a consultation, can I get a response on the spot, so to speak?
Yes, actually, that's how we get them. Most of them are reported by communities, and that's how we get them.
All right.
Our communities are very, very supportive.
We'll look forward to that number at the very least to share with many viewers who rely on us for this kind of information. But for now, let me thank both our guests for your time. Appreciate it. Dr. Magome Masike, who's with the HPCSA, that's the Health Professions Council of South Africa, and not doctor, but Motaletale Modiba with the Health Department in Gauteng. To both our guests, once again, thanks very much indeed for your time. Very important story, this. We'll keep watching the developments as they unfold, at the very least because of what is at stake.